Well, I'm Dr. Montgomery, and I was born and raised in Houston, Texas. And my mother and father were from, my mother's from Louisiana, my dad's from East Texas. And I was the youngest of 3 children. And so I grew up mostly in the Heights and Acres Home, Houston. So if any of your listeners are familiar with Houston, they'll know what I'm talking about from those areas. When I was young, my dad told us that, hey, we're going to, build a house. And so we drove out to the house, quote unquote, house one day. And I was a little kid in the back seat. And so we drive up to this lot and there are weeds. And I get out of the car and I say, Dad, where's the house? And so I didn't understand as a kid that we were going to build a house. But the interesting thing is I saw that lot with weeds go from a cleared lot to a foundation to an erected building, and I actually participated in a lot of that as a kid. I helped hang sheetrock and that type of stuff. Of course, whatever a little kid can do. But my dad had contracted a carpenter, and he sort of subcontracted other workers, etc., and we built a house. The reason why I give you that example is that had a very profound impact on my life, and I think that experience has really impacted what I'm doing now. Because in essence, as a kid, I saw something built from nothing to something. And that gave me the insight to know that, in essence, you can build something from nothing. And so that's what I've been doing to some extent, every aspect of my life. I wanted to go to the University of Texas, just up in Austin. And so my dad says, well, you are, we can't afford to send you to out of state, out of the city. And so you need to stay here in town. It's more affordable. So what I did, being the smart aleck, I chose what I thought was the most expensive school in town. It wasn't actually. Another school was more expensive, but Rice was pretty expensive. So I only applied there. I got accepted. And so the rest is history. I was a biochemistry major. Went on to do my medical school training, University of Texas Medical Branch in Galveston. And went on to then do my subspecialty training. My specialty training at Baylor College of Medicine, subspecialty training at University of Texas Health Science Center, Houston. The summer between my freshman and sophomore year in medical school, I did research with a biochemist who's looking at myocardial preservation of all things. He was looking at aspects of mitochondria and that type of thing. So I was a biochemistry major, and so I was fascinated with that. And so I started working in this research laboratory. And that was the time I decided that I wanted to go into cardiology. And so it was during my internal medicine residency, I had the opportunity to present at Grand Rounds to one of the prominent electrophysiologists in the country, Mark Estes. And there was a patient, a 62-year-old man that had a rhythmogenic right ventricular dysplasia, or an abnormal heart rhythm. And so we presented that case, and I was fascinated with this whole area of electrical abnormalities with the heart. And so at that point I said, you know what? I was pretty weak in reading EKGs, so I want to be an electrophysiologist. After doing all my subspecialty training, I made the decision that I would go into my own practice. I never did look for a job. So 2 years prior to my finishing of my cardiology fellowship, I began laying the footworks of training. So I incorporated, so all my moonlighting went through a corporation. So I started a business, and then I started to build a practice, started learning about what it took to open an office and build and code and the like. So I was laying the groundwork 2 years prior. So by the time I was finished my training, I'd already had a list of patients I was taken from my residency and fellowship whom I'd followed over the years. So I had a patient base lined up and the like. And so secured an income guarantee. In fact, I actually started a little mini HMO where I had about 4 primary care doctors that I started a business, and they worked under that, and I started my cardiology practice all right out of training. So going back to that experience of being a little kid, seeing that, weed-filled lot go from a weed-filled lot to a building impacted my way of thinking throughout my whole career. And so that concept of building it from scratch and to some extent doing things out of the box, I think started right there, with me as a youth. My typical practice as a cardiologist and cardiac electrophysiologist, had privileged lots of hospitals. I took emergency room call, and so I was just everywhere, seemingly all the time. And that was necessary early on to build my practice and build my patient base and the like. However, as time passed, I think maybe within, say, 6-7 years into my practice, I started noticing my own health, maybe declining. When I say declining, my LDL cholesterol was up, my weight was up, and I always prided myself in being physically fit. In fact, I had an interest in wellness, quote unquote, early on in my training. My perspective then was that of exercise and cardiac rehab. However, as I got older and more mature in my practice, I was busy and successful in that regard, but I noticed that my health was a little bit not suboptimal, I'll say that much. I also noticed that my patients, despite all the advanced medications I was giving them and all the advanced therapies, we had defibrillator implants and various catheter ablation procedures. I was able to ablate pulmonary veins to get rid of atrial fibrillation, and ablate the ventricle to get rid of ventricular tachycardia, and implant devices. So all of these things were advancing, throughout my career. But I noticed my patients still got sicker, despite all of the advanced technologies. And so essentially, I said there must be something new or different. Around the time my mother's health started declining, she had some health issues. She was a diabetic, had coronary disease, and I had to manage her. And in managing her condition, I started to really realize that, this state-of-the-art health care, if you will, isn't really effective. I saw my patients decline, my mother's health decline, my own health decline. And I was always looking and reading. I started reading about different diets. In fact, I started applying many of these different diets in my practice. And they'll go unnamed, but various diets. And you're probably familiar with various names and titles and diet types. We got some benefit, but really nothing extraordinary. However, I noticed that I ran across this whole concept of plant-based foods. Now, every diet you look at, whether it's a calcium diet or whatever diet, they say eat fruits and vegetables. So it was always a common denominator, so eating fruits and vegetables. And so there were also these diets I ran across that says eat only fruits and vegetables. And so I said, that's interesting. So some diet says eat fruits and vegetables plus X. Other diet says eat only fruits and vegetables. So there's common denominators, fruits and vegetables. So as I gravitated toward this and I started running across people in the Houston area, mostly lay people, I started doing things like juice feasting and reading about that, and I did a 32-day juice feast myself and felt great and lost a lot of weight. And I noticed that when I started eating this way, my LDL cholesterol, which was 138, went down to less than 70. I didn't want to take medications. I prescribed them all day, but I certainly didn't want to take medications. So I was really amazed with this, and I started applying this therapy in my patients. And so it was quite difficult at first. I have a busy office, and there I'm sitting with a patient and writing out, diet plans and et cetera, eat this, not that, et cetera. One thing led to another. We started getting more and more success. And then the press got a hold of what we were doing. And so they came in and did an interview and talked to some of our patients. And the information went viral. Fox News, in fact, did a story, and the information went viral. That's when I started meeting doctors like Dr. Neil Barnard and Dr. Colin Campbell, who saw the ad, or someone in the organization saw the ad. They reached out to us and said, hey, we like what you're doing, we'd like to help, et cetera. And in fact, in 2009, we were able to put together a conference for the general public in that area. And Drs. Campbell and Esselstyn and Dr. Neil Barnard and Dick Gregory came, and all helping us promote the message, and that really got us, jump-started in that area and in terms of promoting this message. I like to think of that it all started back when I was a young kid, looking at that, weed-filled lot, and understanding that there's a different way of doing things. Other kids moved into a house that was already built, but we moved to a lot and built a house. And this whole concept of thinking outside the box, doing things different than the norm, I think has helped me in this whole process of going to plant-based nutrition and helping with this paradigm shift.